Okay, it looks like we're underway here. So, just an introduction. My name is George Fox, and my son Phoenix, who is 9 years old, has Pompe disease, infantile, I guess, Pompe disease, and then also my wife Gina. It's just the three of us here living in Gainesville, Florida. We lived down in the Keys. Phoenix was born in Islamorada, Florida, which is just south of Miami. There's a chain of islands called the Florida Keys. He was born there July of 2002. Um, he was after about 3.5 months of age. I felt a bump on his head, and so we took him to the doctors for him to be diagnosed, or for her to look at him. And in her exam, she discovered a heart murmur. Again, this is 3.5 months of age, and then it took from 3.5 to 6 months to get a diagnosis. It went from heart murmur to hypertrophic cardiomyopathy, then the hypertrophic cardiomyopathy to Pompe disease. It took a while. Actually, it was about 6.5 months. So it was about 3 months there of searching. Meanwhile, his heart got worse. The hypertrophy in his heart got thicker. His heart function declined in those 3 months. He also got weaker. On a side note, it's a very important argument for the necessity of newborn screening, because a lot of these kids uh, they lose lots of muscle and other functions in a very short period of time. So if you could diagnose before, as everybody talks about, it's possible to stave off some of this muscle deterioration, maybe muscle wasting. So we sent a fax to Dr. Byrne here at University of Florida. The fax was an EKG of Phoenix's heart. Dr. Byrne said he's 99% sure. We have to do a skin biopsy. Skin biopsy came back positive for Pompe. We then moved from the islands, basically down in the Keys. We had good jobs. We had a beautiful house down there. It was a great place to be, but it's not known for its medical care, being that it's on an island. So we had to go somewhere specialized, and we liked the people at University of Florida more so than those in Miami. They just seemed to be a little bit more geared up for the understanding of this particular disease. Dr. Byrne and the people who work with him were certainly on the ball. And that's the same time Genzyme started I guess it's the 1702 trial or 1602 trial with Myozyme, and there was an opening. We really lucked out that we just fell into this opening sort of immediately as soon as we got here. As soon as we got to University of Florida, we started infusing, and that was at 8 months of age. So exactly 8 months of age, Phoenix got his first enzyme replacement therapy, and so we've been doing that ever since. Um, and now he's 9 years old. There really hasn't been any changes. He, at about 3 years of age, he stayed off ventilation until 3 years of age, and then he had pneumonia, 2 bouts of pneumonia. After his second bout, couldn't come off, couldn't wean him from his from intubation effectively enough. So we had to vent him. So we trached him, put the vent on, and we've been like that ever since. I've always kind of kept his ventilation sort of at a minimum, trying to get as much demand from him as far as his own breathing. I've always kind of kept the respiratory therapists, pulmonologists in check as far as not overventilating. I feel like that was probably kind of important, that you find that happy medium, that balance between overventilating and underventilating, where you want to keep the person working as much as possible during that whole ventilation period. And I've done that. Well, we've done that for the last 6 years or so while he's been on the ventilator. So he's kind of always been able to come off to some degree, but not for such very long periods of time. It was about 4 hours at first, and went all the way down to about 30 minutes or less where he could come off the ventilator, but always able to breathe a little bit on his own. There was always a tiny bit of a window there. Um, Hopes and expectations of Myozyme. Of course, we had high expectations and hopes, but we quickly realized that the effectiveness for us was geared mostly toward his cardiac function and his heart, which is great because it's gotten us to where we are. So we're very thankful for that. However, he's gotten a little bit weaker from a skeletal muscle standpoint, also breathing muscle. It's gotten weaker. We don't know whether it's nerve or muscle or both. I tend to think it's a little bit of both. Um, so, so Myozyme was great for his heart, but of course we were looking for something better down the road. That's the reason why we kind of went with the gene therapy, or part of the reason why we're going with whatever sort of we can find. Daily living with Pompe disease, extent of Phoenix's disability. Phoenix is on a ventilator, 100% dependent on mobility. He can move his hands a little bit, can't roll over. You can lay him on the bed and he can't roll side to side. Obviously no walking or things like that. So he's completely dependent upon other people to move him. So it would be nice to try to get some kind of skeletal muscle correction so he could be a little bit more independent. Gene therapy, when gene therapy became an option and when it was initiated. Gene therapy, ever since we got here to University of Florida, it didn't seem like long after that Dr. Byrne described gene therapy to us some 6 years ago. And we've known about it. This gene therapy thing's been in the mix for a long time. I know it's hard to do, and I certainly commend everybody that would delve into that difficult of and understanding of cells and structures and viruses, and there's just so much technicality involved. So of course, we always harped in, how's the gene therapy coming along? And because we knew we needed some other further type of intervention. From a medical or drug standpoint. So the gene therapy was certainly something we were very happy to see come along and when it became a reality. Procedures before gene therapy was started. Not sure exactly what that means, but okay. So possibly it's the working up to exercising the diaphragms, probably what it would be. So respiratory function testing, inspiratory muscle strength training. These are devices where you take the person off the ventilator and put on a device called a trainer. And the trainer is used to strengthen the muscle. And so for about 6 months, we would take Phoenix off his ventilator and use this trainer, doing sets just like you would do exercise at a gym 3 or 4 times a week for just a brief period there, maybe a 10-minute workout routine with the trainer. And so we did that to try to obviously establish a baseline as to his potential before initiating gene therapy. So that was about a 6-month period of what he could do, finding his baseline and his strengths. And so when we actually started, we would have something to go off of. Again, we've continued to do that since the gene therapy as well. Feelings and fears of subjecting a child to such untested therapy. Yeah, no, there's no question that this was all brand new science. And you read about gene therapy. There's, for the most part, gene therapy. The biggest risk was, ineffectiveness, I guess. There are some cases, a couple of cases, I guess, of some blood leukemias. I think with some of with a trial done in France on some SCID kids, and then I guess there was maybe a tumor developed. There were a couple of rare cases of some cancers developing, but not very much, 1 or 2. And then there was obviously the one older child who died, University of Pennsylvania. I don't know why I'm drawing a blank. I forget his name. I should remember that. But there was definitely some fears involved with such experimental treatment. But we had a feeling, maybe a gut feeling, we talked about it, that this was the one we wanted to try. We had a lot of trust in Dr. Byrne, but also I read a lot. We also had a lot of trust in the FDA. There's a lot of review process, a lot of peer review. This wasn't brand new. This drug was used in people before. So we were in a place where we felt we sort of kind of had to take one for the team, if you will. Trying, sometimes you gotta, take a little bit of a leap of faith, and kind of hope for the best, because you're thinking about the generations to come after you to try to push medicine and science. I mean, that's what you have to do in order for the people to come next to get better. So we thought about that as well, and it just seemed like the right thing to do. So we took that chance, so to speak, which didn't seem like a huge risk at the time. It still doesn't. It's a lower dose. There's higher doses to come. So I think with each subsequent higher doses, maybe there's a little bit higher risk of problems, but I guess that will be weighed out. So we'll continue to think about that as we progress down this road. We've often talked about Phoenix's understanding of gene therapy. We've talked about it to him for a long period of time, ever since we got here, and we've been reading about gene therapy. We've told him that there's this gene therapy on the horizon. So when it became a reality, he seemed to be all on board, and he knew all about it. So there was no shortage of storytelling when it came to gene therapy in the Fox household. We talked about it often, and we still talk about it, and we still talk about future therapies to come. I guess that's I heard Kevin O'Donnell talk about the importance of hope, and you hear it a lot. But without hope, you really don't have anything. So that's what the huge importance of all of these possible therapies that are out there is. It gives you hope. And that's really all you need, is a little light at the end of the tunnel, something to aim for. And if you have that, then it answers all of your questions. You just keep striving for that. So that's what we're doing, is striving for the light at the end of the tunnel. So his response to therapy after 1 month, 2 months, 3 months. So we've just finished our 1 year evaluation. Well, next week will be the official end of 1 year. And it seemed like, according to the results that we've had, 1 month after, he was a little bit stronger, and then 2 to 3 months seemed to be his peak. So from an official testing, at his baseline, he was able to come off the ventilator for 8 minutes. A month after that, I think it was like 20 minutes or 25 minutes. And then after that, there was another 3-month study. After 3 months, he was able to come off his ventilator for 1 hour and 20 minutes. And the last one was also about an hour and 20 minutes. Very similar, but kind of a plateau. The testing for being off the ventilator was pretty stringent. It wasn't, when I take him off the ventilator here at the house, I put on what's called a Passymere valve. And with the Passymere valve in a home setting, I'm able to get about 3 hours off the ventilator, which before was no longer than an hour. So there definitely, in my mind, was definitely improvement from a respiratory standpoint, without a doubt, hands down. I guess the level, there's maybe a little bit of fluctuation as far as how much improvement, but I don't want to come up with a percentage. But there was definitely improvement from a respiratory standpoint, noticeable. We're very happy for that. It helps a lot to be able to come off the ventilator, even for short periods of time. Let's see, where are we? Your hopes for Phoenix's future, just to keep striving for additional therapies and see if we can't get him off the ventilator longer, maybe get some more strength in his arms, and also help push the science, which will then help other people as well with Pompe disease, but not even Pompe disease, other diseases. There's tons of diseases out there where the way it seems to work, where I've seen, is that rare diseases sort of push the medical envelope for more common diseases, and that's not a figment of people's imagination. That's a very real thing. That happens. That there's lots of therapies that come out of the rare disease community that go into the more common, diabetes and heart disease ailments. So we're hoping to help, push this science forward, and if we can get into another clinical trial in the future, we certainly will, whether it's with a different enzyme or a different type of gene therapy. We will certainly be, our noses to the ground all the time, or I should say our noses to the internet all the time. So we're constantly, looking and trying to find out what's coming down the pipeline, and we want to be a part of it. So we will always be involved with that. Anything else? That's pretty much it. We really, appreciate, everything, and we just want to try to relay to the community what's going on here with us. It would be a shame that if these things are going on with people that are being tested, or people that are going through clinical trials, if that information doesn't come to the forefront. It's really important through, I don't know if social networking is the right avenue, but at some point in time, the information that has been learned through the clinical trials needs to be presented to the people, and not necessarily from drug companies and clinicians and such, but from also other families that are affected, from family member to family, and other affected families. I think that's a great way to do it, because it's maybe a little bit more personal, and it's good to have it coming from all different angles so people can get a good understanding as to what's out there, and then people can make their decisions as to whether or not they think they would be right for gene therapy or any clinical trial, if their child or themselves would work in that clinical trial. So I think that's important as well. So that's really about it, and I will hopefully see if this works. Okay, thanks. Bye.